see a few others arriving. Welcome everyone to our April Healthy Families Oregon State Advisory meeting. At the end of March, I accidentally said, I can't believe we're at the end of April. And there was only one person who corrected me and was like, actually, no, we're still at the end of March. Calm down. So now I'm extra careful to check the calendar. Time's just flying so quickly, though. I hope everyone's having a great introduction to spring. Really appreciate you all making time to be here today for our HFO advisory meeting. My name's Elena Rivera. I'm the chair of this committee and really excited to have us all and officially call the meeting to order. Christina, is there anything you need me to do for a roll call? Oh, you're on mute.
Thank you. Would we like to do a formal roll call, or would you like me to record it based on who I see?
I'm comfortable with you recording based on as you've seen people arrive.
Okay, will do.
As long as that works for our policies and procedures.
I believe we have all members here except for Rosario so far, for the record.
Great. Thank you so much. All right. Well, it's so nice to see everyone. I thought we'd just do a quick round of introductions. I can call on folks, but please just share your name and where you work today. So again, my name's Elena Rivera. I work for Children's Institute and I'm the committee chair. I'll pass it along to Elizabeth Underwood. I'll call folks' names so we don't have the pauses in between.
I'm Elizabeth Underwood. I work for the Early Learning Division. I'm currently serving as the Healthy Families Statewide Coordinator.
Gwen?
Good afternoon, Gwen Bachtel. I work at the Early Learning Division as the Director of Early Learning Programs. Nice to be here today. Thank you.
Great. Beth Dasher?
I'm Beth Dasher, Program Manager for the Healthy Families Washington County programs. My pronouns are she, her, and I work for Community Action.
Emily?
Hello, I'm Emily Berry. I work at Insights Teen Parent Services, and I'm Healthy Family Supervisor and the Director of Early Childhood and Child Abuse Prevention Programs here.
Great. Melody?
Hi, I'm Melody Carrington. I work for Healthy Families of the High Desert, and I am a family support specialist.
Thank you. Beth Green?
Hi, I'm Beth Green. I'm the Director of Early Childhood and Family Support Research at Portland State.
Thank you. Welcome. Benjamin?
Hi, I'm Benjamin Hazelton. I'm the Home Visiting Policy and Systems Coordinator in the Maternal Child Health section of the Health Authority and Project Director for the Maternal, Infant, and Early Childhood Home Visiting.
Welcome. Brenda Comini?
I learned a shortcut that just didn't work to get off mute. Brenda Camini with the Early Learning Hub of Central Oregon, and I'm sometimes the director there. So.
Welcome. Martha Brooks on the phone.
Hi, this is Martha Brooks. I'm the State Director for Fight Crime, Invest in Kids and Ready Nation, also known under the umbrella of Council for a Strong America.
Welcome, Martha. And then we have a few folks who are not committee members joining us today. So Bettina.
My name is Bettina Schempf. I'm with Old Mill Center for Children and Families, and we have the Healthy Families program for Linn and Benton counties.
Welcome.
Nice to
Kelly Poe.
Hi, I'm Kelly Poe. I work for Malheur ESD. I'm the Director of Early Learning for the hub that serves Malheur, Baker, and Wallowa counties, and we have a new contract serving Baker and Malheur counties, and that's why I'm here.
Thank you. Welcome. Zainab.
My name is Zainab Folk, and I work with Kukatanen. It's a community-based nonprofit in Portland, and my pronouns is she, her. I guess I'm just here just to learn more about what this committee does. Yes, thank you.
Yeah, thank you for coming by. Hannah Hill.
Hi, everybody. This is Hannah Hill from Baker County Health Department, and I am the home visiting nurse for the Babies First and Cocoon programs.
Welcome. Let's see, Kayla Elder, I think popped in her intro into the chat. She says she's the owner of Room 2 Bloom Play Group in Sun River, Oregon. Welcome, Kayla. Dylan.
Hi, also a curious community member. I'm Dylan Robertson from Mount Hood Community College Early Head Start. I'm the program manager for the Child Care Partnerships program. Glad to be
Great.
here. Yeah.
Thank you for joining. Rev. Let's see, Rev Danya, are you there? All right. We'll see if they want to take themselves off mute at some point. Welcome to everyone. So with introductions and roll call being completed, we can go ahead and dive into our agenda. Christina, actually, Christina, I didn't have you introduce yourself.
Hi, I'm Christina. I'm the administrative specialist supporting healthy families, and I help out with our public meeting stuff for this meeting. Thank you for including me.
Thanks so much, Christina. Do you mind pulling up our slides and agenda?
Not at all.
Thank you.
Is that the
Yes,
same?
it is. Yeah. Can you go to our next slide, the agenda?
Yes.
Great. Okay, so thank you everyone for being willing to extend our meetings. Initially, we were meeting for an hour and a half, and we bumped that up just a little bit to accommodate some other work and priorities that we need to get to, knowing that this is a group that meets quarterly, and we want to make the most of our time and also stay up to date and also have some important conversations about forward-facing work. So here's our agenda for today. After making some time in case there's any public testimony from the public, we'll then dive into a legislative update from Martha Brooks and Beth Dasher. We'll hear about some program updates from Gwen Bachtel and Elizabeth Underwood. Beth Green will be sharing some evaluation highlights from our 2019 status report with NPC, Research and Evaluation. Elizabeth will take us through a brief overview of our Healthy Families Oregon policies and procedures to help orient us to some future input that she'll be requesting of our committee. We'll have a conversation, we'll continue our conversation about our committee's desire to really center equity and parent voice in our work, including hearing from Cass Ferder at the Early Learning Division about a lot of the parent voice work and priorities of the division, which will be really exciting, and think about how our committee can kind of fit into the division's goals and priorities. Elizabeth will take us through an update about the strategic plan for Healthy Families Oregon and some planned work ahead. And then we'll close out the meeting. So a lot of agenda items here to get to, but are looking forward to diving in with everyone. So I'm just checking my watch, it's 2:43, and I'll open up and see if there's any comment from the public. None were submitted ahead of time, but I know we have some members of the public join and are happy to hear if anyone has public comment. Okay, hearing none, I'll move us along. Great, so we're really fortunate that Martha Brooks is going to be providing us with a legislative update As you all know, we're in the middle of a legislative session, a long session. And so there are several early childhood and family support priorities and both policy priorities and funding priorities that advocates are working to advance in the legislature. And Martha will be sharing a few updates. And then we'll also hear from Beth Dasher, who will share a little bit about the Healthy Families Oregon Advocacy Coalition that's forming and has been meeting together to give a little bit of an update on their work. So let's start with you, Martha.
Sounds good. First of all, the budget from the governor came out in December, and it was around $108 million additional in early childhood program funding over and above what the continuing service level is or was for the last biennium. And there's a coalition of early childhood partners. We put together our ask, and we're actually asking for $127 million. What has come out of the tri-chairs of Ways and Means, Joint Ways and Means, is that they've asked everybody for a 1% reduction. However, we're hearing that they want to try and keep all early childhood programs harmless and at the continuing service level, the CSL. We don't know if that will happen. We're continuing on our end as a coalition of partners to push for the $127 million. Having said that, earlier this week on Monday, the Ways and Means Subcommittee of Education, which is where the Healthy Families Oregon budget resides, held a hearing on the early childhood budget. That bill is SB 5513. We're feeling really good about that. The public testimony was pretty awesome. We had an awful lot of people testifying on that. Marguerite Carnegie testified on behalf of the Healthy Families Oregon Coalition. We also have I told you about the budget framework that came out. And with that, the tri-chairs announced earlier this week that they would go back to their roadshow, or at least what we call the roadshow of going around Oregon and holding public hearings to hear from the general public. This year, because of COVID, that roadshow will look a little bit different. It will be virtual, but it will still be congressional-wise, with the first one on April 14th in Congressional District 1, and then CD2 on the 17th, CD3 on the 21st, CD4 on the 22nd, and CD5 on the 24th. If anybody's interested in testifying, let me know, because we would really love to have some program managers, home visitors, and some parents in each one of those districts. And the key is you need to be in that district in order to testify. The testimony will be only about a minute, minute and a half, and happy to talk to anybody and help with your testimony. We also have the Early Childhood Coalition Advocacy Days, pretty much led by Children's Institute. And the kickoff day is May 4th, and then we will do the virtual Early Childhood Days the 5th, 6th, and 7th. And you can register for that. And again, you can probably ask Elena, but you can ask myself too, how to register to participate in those. And we'd love to have some HFO folks participate in all of those events. Then earlier this week, like I'm trying to think when, Monday, so we're only Tuesday, sorry. Wow. HB 2503 and HB 3073 were up for a work session. What 2503 is the child care subsidies, some changes out of Oregon Department of Human Services, moving some responsibilities over to the Early Learning Division, but that is also in conjunction with HB 3073, which is what we are calling the governance bill, and some more child care. where they are working on moving the early learning division from a division to an agency. And there are, there's just dozens and dozens of amendments to that. So they did to both of those bills. And we're hearing that 2503 will possibly get rolled into 3073. And the work session did not happen yesterday, but it's still on for work session and will come out of committee at some point. So continue to watch for that. There's another set of bills, SB 236 and HB 2166, which you might be interested in, which are suspension and expulsion bills for early childhood. 236 is set for a work session on the 12th, 2166 on the 13th. My hunch on that is that 2166 will probably be the bill that survives, but we don't know that for sure. So we're just waiting. It's good news that both of them are on a hearing because they really are tandem bills that work together. Then, as an update, the House is reading all of their bills. There's a rule that says that if everybody agrees, pretty much both sides, R's and D's, that you can waive reading of the bills and just read the title and basically what the bill is about. The Republicans have said no. On the House side, they want to hear every word, so they have an auto reader that's auto reading away all of the bills, and that has slowed things on the House side. So it's questionable how many of the bills will actually get out of the House side and onto the Senate side to become law, or to go to the governor's desk to become law. The Senate side is not reading everything, they're just reading title. Having said that, we'll see what comes and what kind of, rockets down the freeway, I guess, is the lack of a better terminology. I'm happy to take any questions if anybody has them. Not sure if I have the answers, but I will try.
Thanks, Martha. Are there any questions from committee members for Martha about that really thorough and extensive update? As you can tell, it's been a busy legislative session and there are lots of priority bills that advocates are tracking through various committees.
Right. I didn't give all the bills.
Oh, no.
So you know, I gave the ones I thought you all might be interested in.
Yeah, thank you. And I'll be happy to send out after the meeting a link to sign up for Early Childhood Advocacy Day, or Lobby Day rather. We have registration forms in both English and Spanish for folks who would want to participate in advocating for early childhood policy priorities.
That sounds really good. Thank you, Elena. And I forgot, I don't think I mentioned that the advocates are working or asking for a $10 million increase for HFO.
Thank you. That's an important piece of context for this committee to know that $10 million proposed increase in funding for Healthy Families Oregon is a part of that large investment package that advocates are advocating for $127 million for new early childhood funding. Zainab,
Correct.
I saw you unmute yourself. Did you have a question?
Yes, I heard you say that you had translation in English and Spanish. Any other languages besides English and Spanish?
Not at this time, but I know that we're trying to identify partners to do additional translation for other languages and communities. Yeah. Thank you. Okay, if there aren't any other questions, Beth Dasher, would you be willing to share a little bit about the Healthy Families Oregon Advocacy Coalition and what y'all have been up to?
I actually see Benjamin has his hand raised.
Oh, I'm sorry. Go ahead, Benjamin.
That's okay. I was trying to figure out best way to do that. It's not so much a question as a thought that I thought I would pose to the group, and maybe when the parent partner person joins us would be a good time to talk more. I have been a little concerned and would love to be talked out of this about the children's district bill that was in a previous session as well, and whether that could cause inequities across different communities as a accidental consequence.
Mm.
Benjamin, are you talking about the, I want to say that SB 299, I think, Chuck Riley's bill?
I don't know that I memorized the number. I know that it was in a previous session. It's in this session, and I worry that, you know, wealthy communities will take advantage of it, and unwealthy communities will not be able to take advantage of it. But, you know, I may be worried about something that I don't need to be. I just it has haunted me a little bit the last two times it's been up.
Happy to talk about that offline, but I would just say that I think you should not have those fears. What Washington County wants to do is have a children's levy similar to what Portland and Multnomah County have, and a lot of those resources, in fact, I think all those resources go to lower income, minority, people of color programs to help them out. And that's what Washington County does right now. You have to get the permission of your county commissioners to put a ballot initiative on the ballot to even vote on it. So what the idea is to try and get the ability so that counties, municipalities, other areas can go ahead and have a levy and go ahead and pay for a lot of the programs that we're interested in. So I know Washington County wants to have some more funding for healthy families, home visiting, pre-K, after school programs, those types of things.
Okay, maybe I need to take a closer look.
Yeah,
Thanks.
I'm happy to talk to you. Yeah. My organization supports them if that helps.
Any other questions? I'm trying to glance down my list of people's videos. Okay, I don't see any other hands raised. Okay, Beth Dasher, I'm going to turn it over to you.
Thank you, Elena. So regarding the Healthy Families Oregon Coalition group that is in development, and I definitely clearly state we are still in development. We're figuring stuff out. We're doing our best to become organized and become visible. In general, we are supporting the broader early childhood legislative agenda, but of course, including really putting our support behind the additional dollars towards Healthy Families Oregon. One of the bigger conversations we've been having recently is regarding many of our regions having a difficulty in either obtaining or maintaining staff due to the compensation challenges, especially as a lot of the other early childhood systems around us have been recently successful in increasing their salary and compensation packages. So, you know, staff with similar skill levels are being drawn off to some of the better paying positions. And we're hoping that this will be an area of focus if Oregon does increase their budget to healthy families. And similar to the work that Relief Nurseries did recently, we're starting to do a basic salary survey to determine just what that compensation spectrum looks like across our programs. And we were wondering if the state who does have this data has looked at the existing data, and if it's something that could potentially be shared with us as we continue to try to support this work. So that's our update. Pretty short and sweet.
Thank you, Beth. Did I hear in there a question for our ELD staff?
Yes, that was a question and that could again be something that's discussed later offline, but we know that we submit salary data and budget data all the time. Is it something that can be shared or not so much is kind of the question.
Got you. Elizabeth or Gwen, do you want to chime in?
I'm wondering, Elena, if Gwen is still on, if she could do her piece, because she's actually got a meeting conflict coming up and she just has a few minutes to be with us. So if she's still on, I wonder if we could come back to this question in a few minutes or at another point in the meeting.
Sure. Yeah, Gwen, I see you on. Would you like to jump into your updates and then?
I'm really sorry, and thank you for the question. I know that we'll be able to get a response, and I apologize for kind of interjecting. I have to facilitate a meeting actually in 1 minute, so I'm a little bit, but I really appreciate you allowing me to sneak here. So, and it was really great to hear the updates on legislation, even though I hear it from, within the ELD, it's always nice to hear it externally as well. Elizabeth had asked me to come on to share with you our plans for, I think most of you are aware that we have posted our the HFO manager position that Elizabeth has so graciously been filling for a while, but has chosen not to continue in this role. And so the application closed this past Sunday. We received 30 applicants, and I did a quick scan and some really great candidates. HR is now reviewing those, and then we're planning to do first round interviews next week, and then second round interviews the week of April 26th through 30th. It takes about 2 weeks then for us to get a job offer. That's good in the state systems for working with HR to get through references. I mean, that's of all things in order. And then if, fingers crossed, the earliest I could see would be probably mid-May hiring. Depends on how much time the individual candidate would need to transition out of a current position. So that's sort of an unknown. The fortunate news for us is that Elizabeth is staying with us at the Early Learning Division and has agreed to be part of the onboarding process for the new person and to make sure that's a smooth transition. Yes, thumbs up on that. And then also we have, as you know, through that transition, there is myself, Christina, and also Don Baker, who I think you've all met. So to kind of ensure that all goes as well as possible, I have to say, that's like an ideal timeline. I have found that there's a lot of different things that can make that go a little bit astray. So I'll try to keep you informed if that's something that this committee desires. So.
Thank you so much, Gwen. Yeah, that's really exciting to hear. There's been such great response with applicants, and we'll hope that by our July meeting, there might be a new statewide coordinator to introduce to the committee, or at least a further update from you. So thank you for joining us.
Yeah, thank you so much for allowing me, and I'm very sorry I'm unable to stay for the whole meeting. Take care.
Thank you. Bye, Gwen. So Elizabeth, do you want to circle back to Beth's question and kind of fold that into some of your other program updates that you were going to give?
I think I can do that.
Great, thank you.
Okay, so it looks like we're ready to move on to some of our program updates. And I guess I'll start with the salary one, since that's the question that was posed. We do have some constraints at the Early Learning Division around sharing individual salary information. And we don't hold information like things like people's starting salaries or position starting salaries. We just, receive it wrapped into a budget. And so we can't with any certitude really confirm what salaries are. That information really has to come directly from the agencies. And so it would require, as you were describing, Beth, another survey in order to get updated information. The last time there was a survey at the Early Learning Division around program salaries and benefits, that was a few years back. And we unfortunately don't have data on the permissions or confidentiality or consents that were related to that information, and it's not current. So it would require another survey and some sort of protections around agency confidentiality to share that information out at this point. So that's kind of the story of collecting salary data. I did check because we've had a request. I've checked with our data leadership to see whether it would be possible to share the previous information, and without kind of that explicit consent on the part of agencies, we couldn't share it, unfortunately. And not to say that we don't want to support this effort in any way. So I'm happy to also have more conversation offline about what's possible and what's not. Okay, I hope that was a helpful response, or at least a clarifying one. And I'm going to just talk briefly about our database work, because that's been sort of a priority and continues to be one. We're able to, since we last met, complete some required documentation and reviews. And we completed a proposal it's kind of considered a business case, where you look at different options for our state IT oversight group to look at and review. And all of that, the business case and the budget and so forth, have been approved by the Early Learning Division and are now under review by the sort of state IT oversight committee to determine, first of all, the level of complexity, and that took place already. So we're one more box we've checked off, and we're now waiting to really get kind of a specific time frame, to build a specific time frame around kind of what the expectations are for the steps that we need to go through to reach out and purchase a off-the-shelf home visiting system or data system. So the good news as well is that we've gotten some more internal support for the project. Alicia Meow, who joined the ELD as recently, she's the new director of data management and strategy, a new position, and she is the sponsor for the project and is very supportive of the project and will be a great asset to have as part of moving the work forward as efficiently as possible. I think we will want to loop back and include our data work group folks, including program managers, once we have more information on timelines and activities, and then review that with them and look for ways to lean on their expertise. Are there questions about that one?
Elizabeth, there's a question in the chat about whether the HVOL is still the system being considered for the database. Kind of
Thank you. Good question. It is. It is the preferred, which stands for Home Visiting Online System, and it's a system out of New York State, and it is built to be an HFA, specific to HFA programs. So I'll move on to talk just a little bit again now about sort of the last year, which has brought about so much, which has had the pandemic having such a big impact on our program. And so I've been mulling around, how has this impact, how will our data look at the end of this year? How is it looking now? Where are more supports needed with virtual home visiting, with staff COVID fatigue, and with the challenges of using the same tools online as we previously have used in person, and some of the barriers to working online as opposed to in person. How will that ultimately affect our data for the year? And not only obviously has this pandemic required that we shift program operations and shift how we support staff and families, but we do expect that in some fashion or another, it's going to impact our program outcomes. We've already heard anecdotally things like staff retention. There's been a lot of staff leave that folks have needed with all of the stressors of the last year. And it's been difficult to recruit new staff. So some programs have also reported that it's been challenging to get screening done since they are no longer able to be in the hospitals due to COVID, or partners or just simply being otherwise engaged with COVID, like health departments. So they've had to really come up with new strategies to try to outreach and engage families virtually. So we rely on our NPC evaluation report, which Beth will be presenting about, for our sort of final data to that's valid and accurate to reflect, the program outcomes. But in the interim, I've been looking at some of the data that programs submit to the Early Learning Division directly, and just noted the following, that we have seen a decline in families from 2019 to 2020 of about 200 families, or excuse me, actually 100 families. So while that number isn't a final number, and it gives us a sense that we may be seeing a decline in the number of families we've been able to enroll related to COVID and access and outreach difficulties. But we'll know more later. We also just looked at whether programs have been able to keep caseloads full because of this challenge to enrolling families and screening families. And most recently, the data we looked at for October through December of 2020 looks like programs are working hard to really return to full caseloads. In the interim, there have been some dips, and a couple programs in particular have really struggled to continue with the same level of screening that they've maintained prior. Overall, we see, a return to full caseloads, which is great to see. Questions about that?
We do have a question in the chat. Oh, go ahead, Martha.
Yeah, sorry, I'm on the phone, so I don't see hands or anything. So sorry if I walk over somebody.
That's all right, go ahead.
Elizabeth, okay. Elizabeth, I don't understand when you said you had a decline in families of 100. Was that families that were enrolled in the program or on the waiting? Well, we don't have a waiting list.
It was related to total families enrolled in the program for the year.
And that was all the way across the state?
It varied. That's a statewide number, and it looks different in different programs. So it doesn't, not all programs experience the decline.
Okay, so it was actual families enrolled.
Mm-hmm.
Okay.
And that decline was based on looking at the prior year. Is that correct?
Yes.
Okay, great. Thank you.
Okay.
And then I did have one more question in the chat about the database and just compatibility, whether it meet the HVOL system would meet the needs of MCV data collection as well. I know that data sharing and interoperability of data systems for home visiting has been a long conversation in Oregon. So any updates on that?
New York does get MCV funding, and there are some other programs that use this model around the country that do MCV. So I am not sure how much of the MCV data has had to be customized versus I do see in the home visiting online system that there are some accommodations for MCV, but I'm not sure if they meet all of them and whether some of them have to be customized or not.
Yeah, that would be great if you, as you're learning more about that system, Elizabeth, that just, sharing back and updating with the committee on that piece, because I think the data sharing and just acknowledging we have multiple home visiting programs in Oregon, and any efforts toward greater alignment across programs is really desired. We'd love to hear updates on that. Thank you.
Thank you. Thanks, Elena.
And then you had also wanted to chat about HFA best practice standards. Is that right?
Let's see. I think I wanted to respond to Melody's question. I see the caseload vacancy are really based on best practice standards rating indicators, as you asked. So the best practices say folks need to have between 18 and 24 points if they're a 1 FTE home visitor. And so that is, the 5% vacancy is based on that. Okay. I'm going to move on to our next agenda item. And are we ready to talk a little bit about, maybe we need to just take a gander back at the next slide and get started on, I think we're actually ready for our evaluation report.
Did you have a chance to talk about the new best practice standards?
Thank you, Beth. I think I was going to roll that into the next piece of the presentation, so I'll be happy to do that.
Okay, thanks. So let's turn it over then to Beth Green with MPC and PSU to share a little bit about our 2019 evaluation report.
Okay, I think Christina's going to pull it up, and I'm going to walk you through some of the key findings. This is for the 2019 fiscal year. So just to keep that in mind, it's a little bit starting to feel old, but this data took a lot of work to pull together. So I'm going to dive in and just quickly go through some of the highlights. Of course, as always, you have access to the full detailed report and data tables if you're so inclined. Okay, Christine, the next slide. Okay. And next slide, just noting my colleagues, Jared and Anna Malsh at NPC. So I'm going to talk first about some of the implementation data that is collected, as well as then some of the outcomes and recommendations for next steps. All right, you can move forward, Christina, thanks. So first, information about screening and enrollment, which Elizabeth gave you a little bit of heads up here, that during 2019, the program was screening fewer families than had been the case in 2018. But as has been the pattern for HFO over the years, those screenings are happening in a timely way during either the prenatal period or within 2 weeks of the baby's birth. In terms of the lowered screening rates, we've talked about this before, those of you who've been participants in this committee, that our sense is that there's an increasing focus on the higher screening, the higher risks families, and the data bear that out, as opposed to more of a universal screening approach, which was sort of the priority for a number of years in the program. So that's just something to note. I just saw a question come up in the chat, but I'm sorry, I didn't get a chance to read it.
Beth, it's asking if fiscal year 19 is the year that ended June 30th of 2019, or could you just give us that time frame?
Apologies, yes, it's actually, we changed our reporting to be calendar year reporting for a variety of reasons. So this would be January 1, 2019 through December 30th, 2019. Okay. We also we have had some data issues that we're working to address, that in terms of missing information that we need to figure out, and we're problem solving and hopefully doing some training this year to improve the quality of the data gathering and the training provided for data entry. Okay, next slide. So about we always track acceptance and then actual receipt of first home visits. So we had this year about 63% of families, of those who were offered home visiting, at least verbally, who said, yes, I'm interested. And of those, about 85% actually received a first home visit. That drop off happens for a variety of reasons, but this rate is actually fairly high. We have seen a decreased rate of that sort of verbal acceptance, which I think is interesting. I'm not quite sure why that's the case. I'd be interested in program input on that. And also want to note that we see patterns where both our Hispanic Latinx families are more likely to accept services, as well as families who are screened prenatally, which is interesting. Okay, next slide. Okay. We always track of those who verbally accept, and then if the program goes back to try and offer them service, whether or not they could be served based on capacity. And this year there was a decrease in the number of families that we were unable to serve because of those caseload limitations, about 350, or because of program capacity, and then a few because they didn't meet some of the local priority criteria for actually offering them a service. As we know, a few years ago, local programs were asked to prioritize those higher risk families, higher needs families, so have local priorities that they can impose. Okay, next slide. And again, questions that are coming up in the chat, I don't know if Elena or someone, Elizabeth, could you monitor those and maybe give me a signal if I should pause and address one?
Sure, yeah, there is one question from Melody asking if verbal acceptance is considered when the family is screened in the hospital or when they're contacted by the home visitor.
It depends on local program sort of design. I think it happens at different points for different programs, but it's basically whatever the response, whatever your program does when it's filling out the form and says a verbal offer was made, and it's usually, it is related to the family saying, yes, I'm interested if services are available. So it's not a concrete offer of a slot, but it's that initial yes, I would be interested if I'm eligible and available. Just where that happens differs. Okay, here's some of the data that Elizabeth was referring to in terms of enrollment numbers going down slightly, although they stayed fairly flat compared to the previous year. The bigger drop was from fiscal year 16-17 to 18. And you can see overall, there's sort of just a general pattern of decrease in the number of enrolled families. On the other hand, yeah, so we can go on to the next slide. Okay, next I'm going to share a little bit of information about family risk factors. As you know, do screening with the NBQ, and there are yes/no items. There's 15 total items. This year, they averaged 4 high risks or yeses to those items out of a total of 15 possible. And the most frequent were the difficulty paying for expenses, which is not surprising. Almost all of our families are, as noted here, over 3/4 are at or below the federal poverty level. About 2/3 are single parents. Many lack stable employment, fairly high levels of self-reported anxiety, and about 1/3 lack a high school diploma or GED. Okay. Next slide. We have some missing data issues. Again, the parent assessment is a more in-depth assessment of family stress or parent-parental stress, and it looks at both pre-existing stressors or prior trauma experienced by the family, as well as ongoing issues. So you can see, and this is fairly consistent with prior years, about 3/4 lacked nurturing parents themselves. So these families tend to come from families where maybe they experienced not as much positive support from their own families as we might want or hope. A large proportion have either substance abuse, mental illness, or criminal history in their background. A lot have multiple stressors happening in their lives, and a lot are experiencing social isolation and low feelings of self-worth. So all of those things really do create a lot of stuff going on for the families that our program is working with. Okay. In terms of demographics, you can see here the light blue bars are the Oregon general population of mothers compared with families who are enrolled in the home visiting component. You can see that in general, we overrepresent Hispanic families compared to the general population, and that the other things are relatively similar. We tend to have slightly more African-American moms compared to the general population, as well as multiracial moms, and lower than what you'd expect demographically, which is related to, of course, probably the confluence or the confounding of race, ethnicity, and some of those demographic structural risk factors around poverty, et cetera. Okay, next slide. All right, retention. So how long do families stay in the program? This hasn't changed a lot for us. And in general, we're hovering right around what's comparable for other programs nationally. We have good upfront engagement. So about 85% of our families stay in at least that first 3-month period. And then about 2/3 tend to be done with the services by about a year after enrollment. We also see that Hispanic and Latinx, who are both more interested in accepting and more likely to accept services, do tend to stay in for a little bit longer, as do our other families of color. Okay, next slide.
And Beth, we have a quick question in the chat about how the evaluation study is conducted. Is it a combination of verbal and written, or
well,
the kind of data
combination, the data that you were just looking at is based on administrative recording from the program. So the date that the family enrolls compared with the date that they actually exit the program. So that's how we calculate that particular variable. Other information is collected by the home visitor using the parent self-report or other sources of information. And then other data that I'll get to in a little bit is from a parent self-report on paper pencil surveys primarily.
I'm sorry, quick, I'm sorry, because I know I have to get off in about 2 minutes, but there was 3 slides before that where you actually talked about parents and what, I'm not sure what that information came about the parents itself. Before
the family stress.
Yes.
So
yes, thank you.
Yeah, happy to answer that. Beth, anybody from the program can weigh in, but this is a standardized sort of, it's a standardized protocol, but it's a series of relatively open-ended questions meant to get at some of these issues through sort of a conversation or interview with the family. So it's a one-on-one interview between the home visitor and the family. Does that seem about right?
Yeah, it happens very early in the program once they've started receiving home visiting services.
Right.
Thank you. Appreciate it.
Yeah, no problem. Okay. Okay, you can go to the next slide, Christina. Thank you. So in terms of exit reasons, you can see here that most of the families who exit are basically declining further service for a variety of reasons. They might be like, I've been here a year, I've gotten what I need, thank you very much. They also, a few, about a third, 30%, reach their age limit. So those are the kids who are aging out of the program. A large percentage move to another area and no longer, and either don't re-engage with services in that community or move out of state, for example. The other thing is we see families, the average age of children at program exit is increasing. We have a relatively solid chunk of families who tend to stay in for quite a long time and then, eventually age out. So it's interesting to note that, we have that cluster who seems to really engage and really get something out of the program and stay in for a long time. And then another that drop out more right around 1 year, which is actually the sort of typical place where home visiting, families who are being reached by home visiting tend to stop or decline to continue services. Okay, next slide. All right. I'm going to move into some of the outcome indicators. Again, now, so these are a combination of things that are tracked either by the home visitor or reported by the family. So the home visitor collects data about their connection to health services, and we have really high rates of connecting families to primary care, high rates of immunizations. Then that's based on record review through the alert system. Parent reading is reported by the parent, and we have a very high rate of reading to children early in their lives, which is great, as well as positive parent-child interactions. And we see reductions over time from the time families enroll to 6 or 12 months later in their level of parenting-related stress. We also have parents telling us that, among other things, Healthy Families is helping them feel more socially supported, better connections, and we know how important that is for new families. It'll be interesting to see what that looks like this year. Okay, in terms of indicators needing improvement, we have only about 71% of children were in our data system as receiving an timely ASQ screening. So the goal is 90%. This screening data, however, both the ASQ and the depression screening data has been really challenging to track since we lost our statewide data system. It's basically tracked, well, ASQs are now tracked through bubble sheets, and depression screenings. I'm trying to remember if that's bubble sheet now or if it's bubble sheet now. Okay, that's what I thought. We first were using Excel spreadsheets, was just not good. So we have some work to do, I think, here around data improvement, and some of the case file reviews that have been happening suggest that those ASQs actually are being done, but still having a problem between actually doing the ASQ and getting the data recorded in the data system. Okay, next slide. One of the things that we've seen pretty consistently over the last few years is some relatively small but important improvements in outcomes for families who actually get services prenatally. So we have a fair number of families who get screened prenatally, but a relatively small number who actually receive home visits prenatally. But we have seen this particular pattern that if the family is enrolled prenatally and served prenatally, we see somewhat reduced likelihood of having a premature birth, and also a increased likelihood of breastfeeding at the time of the baby's birth or initiating breastfeeding. So both of those are really positive, and I know there's lots of conversations that have been happening locally and nationally around increasing the rate or the frequency of those prenatal home visiting services. Okay, next slide. I think I just said this. And then in terms of other outcomes, just to compare to some trends, so you can see where our program is really shining in terms of that daily reading. You can see that compared to both the national and the Oregon averages for reading to young children, we have quite a high, almost twice as high a rate for our Healthy Families parents. We also have a really high rate of children who are reported by their home visitor as having a well child exam in the prior year. And then again, a slightly higher rate of health insurance coverage compared to the Oregon state average. So all things to celebrate. All right, I think I got through that in the allotted time. Are there questions other than the ones I've tried to respond to, or reflections? And you can take that slide down if you want, Christina, so we can see each other better now.
Thanks so much, Beth. A couple of things just popped to mind for me. I think those program outcomes really speak to the benefits of Healthy Families Oregon programming. And so I think that they, serve a dual purpose in both being able to reflect on impact and also for our advocacy work. And so just want to make that connection. And then I also just heard a couple areas where maybe we might want to get some additional insight from home visiting program staff or home visitors or even families around looking at lower acceptance rates, those ASQ and depression screening rates, and just kind of identifying, I think it's a long-term goal for our committee, but just identifying where we need a little bit more information and for parents and home visitors to help us fill in the gaps. But are there any other questions or reflections from other committee members?
Thinking quite a bit about the acceptance rate and since you were inviting programmatic input, Beth, my theory is that it's not dissimilar to how at the programmatic level, we need a little bit more streamlining like we did for the ASQs. So for example, I'll just like speak kind of very here locally. When I can remember a time where we weren't inputting information into the Clara system about declined referrals. I think it speaks exactly to what Melody was saying earlier about what does acceptance mean. So several years prior, acceptance to me meant they said yes in the hospital, and then I would receive an MBQ at the local programmatic level. And if I didn't reach them, I would fill out this little NPC form, the early declines, and say we were unable to reach them. At some point, I believe the messaging shifted that if we weren't able to contact them, then I didn't need to fill out this form. It was just something that was meant to be like the language doesn't match up between this NPC form and that last page of the MBQ that reflects the Clara system. So I think that that's where the discrepancy is happening, that I'd like to dive into, because I know that that's a significant data point that HFA looks at.
So the other thing is, that's a really important point to bring forward, I think, as something that should be addressed in the newly being developed data system, so that you have a way to record that particular nuance again in the system.
It's kind of like clear definitions of what the question is asking, kind of.
And I know that Jared is going to be providing some consultation. I'll make sure that that question issue gets back to him.
Yeah, and there was definitely some discrepancy with the ASQs, like at the programmatic level, where maybe the data tracking sheet said you're meant to do a 6-month ASQ, or it's the 6-month time frame to do an ASQ. The 6-month time frame to do an ASQ, but the baby is actually 8 months at that point. So if you do a 6-month one, then it's not developmentally appropriate at that point anymore. So it's just it's just in the language sometimes when it comes really down to the person doing the piece of it.
Yeah, and it got
the fun of the data collection.
The ASQ is just so complicated because the intervals of doing the assessment don't match the requirements for when it's reported. As you know.
I know in the past too, we've had, I've noticed that there's a couple days discrepancy in the data tracking dates that it populates for when something needs to be done. It seems to kind of change. I don't know if it's probably been corrected at this point, but I noticed that when we were having some updates that would happen, and it would have different dates, and then, but it would almost fix itself just only on the birthdays, but the other months in between were a little off. So, and how much, if any, impact that had on that particular data, I don't know, but I know that that's another thing that's that we noticed.
Those dates are calculated based on rounded figures. So for example, a 6-month ASQ would be based on 180 days.
Right.
Melody, were you speaking to the HFO data tracking form, or were you speaking to an HFA ASQ Excel spreadsheet?
No, the HFO data tracking. I was just thinking if that had anything to do with the collection.
Yeah, I can't speak to that because I'm not sure how that system works or is calculated.
Yeah, because in the end, the standard would say you do two on-time ASQs a year that are at least 4 months apart.
Right.
So it doesn't really matter if you do the 6-month and the 12-month. It doesn't really matter, but that's the default, or that's the prompt that home visitors received.
Right.
That one's been tricky.
And that's an HFA requirement and tracking mechanism.
Yeah.
Well, I don't know, Elizabeth, if there's going to be, again, that's something for the new data system, is to have a better way to track that.
Yes, that is in fact, can you hear me? Yeah. Yeah, good. That is in fact contained within this new system. So yeah. But it's a really important issue to fix. And I agree with the conversation around, you know, sort of some of the discrepancies that are contributing to the challenge. Absolutely. It'll be a huge help to have a new system.
That challenge that Emily was describing about having the 6-month time frame and an 8-month baby in Washington County, we decided to purchase the ASQ enterprise system in an effort to make sure that our ASQs were in the correct time frame when being, you know, given to families, and we're still struggling with it even with that system. It's just hard.
Other questions, reflections?
Beth, remind us when you'll be back with some 2020 data to share. I think, you know, as Elizabeth was providing her updates on the impact of COVID, it's on all of our minds. And so just reflecting on like what's changed about services and acceptance and all of that, and, you know, screenings and all of the requirements.
I'm trying to think off the top of my head what the new deadline is, Elizabeth. I know we're waiting. Yeah.
Well, I haven't really gotten a final framework to share with the network around when it's going to come out. I think I think NPC has had to postpone some of the work because of some of our contractual sort of delays. And so I know Jared's working hard to put together a timeline, and as quickly as possible. And as soon as I have that, I will get that out. But we do expect that the status report typically is published in July, and that there is a delay, hopefully of only a month or so.
Yeah, thank you.
Can I just share one thing about ASQs that may be helpful? Is that okay?
Yeah, go ahead, Melody.
I was just thinking too, I know that when families are getting closer to graduating and they have less frequent visits, it doesn't reduce the amount of paperwork that is required of us to do with families when the child is getting ready to have their 2nd or 3rd birthday, and they may be down to 2 or 1 visit at that point. And so you still have the same time frame to get these things done. And, you know, the MPC forms and the ASQ, the ASQSE, the other things that you're doing with them. So I'm wondering if that might have some impact too. I don't know if there's specific data around the ASQ completion being done on time for like certain ages of children, if that's kind of what might be impacting some of that, or just what that would look like. I'm not sure, but I do know for myself that it's quite a task, because you kind of have to plan the visit prior to the month of their birthday, like after the date of their birthday the next month, so that you're within that month time frame, if that makes any sense. So you have to kind of strategically, you know, position your visit the month before and the month after to not be after their, like, if their birthday's on the 15th, you know, you want to have that one visit for the 3rd month, you know, the 2nd month right after their birthday, you want to have that before the 15th, and then the 1 month prior to their birthday, you want to have it after on the 15th or after, you know what I'm saying? So it's kind of like a puzzle that you're putting together. So I don't know if that is helpful at all, just in terms of how that works within the time frame. But
I think it's interesting. My assumption would be, although I don't know this, of course, this is just my assumption, that HFA developed that standard, assuming that families were still getting sort of level 1 services through their 3rd birthday, which obviously is not the case. Be curious to know.
Well, thank you so much, Beth. It's always really exciting to see just some of the indicators and areas where we have questions to dive into, but then also areas to celebrate. I think it's really exciting and always so motivating to see what impact HFO is having on families. So thank you for coming and sharing today. Elizabeth, I'm wondering if we can chunk your policies and procedures overview with the strategic plan update, so that I know Cass has been on and want to honor her time. So if we can transition into talking about kind of equity and parent voice now, and then do the policies and procedures with strategic plan. Awesome. Okay, great. Well, I'm just going to do a quick piece of framing. So we've had a few conversations on our committee. You can advance the slides, Christina. Yeah, perfect, here. We've had a few conversations on our committee up to this point about just our values around equity and parent voice. And in particular, in January, we reviewed the ELD equity lens and had a conversation about what equity means to each of us and what opportunities we see to really start to build in a greater focus on equity and centering parent voice in our work as an advisory committee. And so we wanted to circle back on that conversation. So on the next slide, Christina, you can see just some of the kind of notes from our last conversation in January. We did a lot of brainstorming about what our values are as a committee. And then, as I said, just what some near-term opportunities might be to start to dig into parent voice and what opportunities we could potentially pursue as a committee to really build in parent voice and parent leadership in our work as an advisory. And so I just think it was an exciting conversation that demonstrates our commitment and that this is going to be an ongoing focus for our committee. And it also raised, as Elizabeth and I were kind of debriefing, just some thoughts around the fact that anything that our committee takes on really does need to be aligned with ELD priorities and work. And I was wanting a little bit more background about how the Early Learning Division is thinking about equity and parent voice and just what work is happening at the division level. And so we're so lucky to have Cass from the Early Learning Division join us today to talk about her work and how the division is prioritizing parent voice and really building greater capacity across the state for parent voice. So we'll hear some updates from Cass about that, and then we'll do a little bit of brainstorming together about what contributions our committee could play that would be aligned with the Early Learning Division. So Cass, I'm happy to turn it over to you.
Okay, well, good afternoon, everyone. Thank you for having me. And I was able to listen in on a little bit about your agenda today, and it's really exciting to hear all of the positive outcomes that are happening, the increase. I love seeing families reading to their children. That's like a passion of mine. That's wonderful. So kudos to all that happening. So one thing that when I met with Elena and Elizabeth, we talked a little bit about a couple things that Elena teed up for me. And so in terms of what Early Learning Division has done around parent voice, family voice, parent leadership, thinking about it as a community. So as families, our parents, they're also community members. And so really elevating that voice through Raise Up Oregon and all the other strategic plans, goals, outcomes that we're looking for all seem to point to that parent voice. And so in the last legislative session, the division proposed the concept of a statewide parent family engagement and education coordinator. And the legislature approved that concept, and that's why I'm here today with all of you. My job was made permanent. Before, I was in a limited duration position doing some of this work, but mainly focusing on rolling out statewide the VROOM program. So adding this parent piece to this has just been like the cherry on top for the work. So after the legislature approved the position, the next session, we rolled into the Student Success Act, which also gave a nod to the importance of family voice parent leadership, really elevating to make those system changes for the people that are using the system. And so they identified $1 million annually to support ongoing and in addition to build capacity around parent ed. So I worked with Oregon State University and the Oregon Parent Educating Collaborative, and using the ECE sector plans that the hubs did last year, we identified priority populations. And as of this last week, OSU is working on subgrants to get out to the 16 parenting hubs, $44,000 to each hub to expand capacity around that parent ed. And then also there's some dollars around training trainers so that that extra capacity can actually take place and happen in the communities around the state. The next thing that they've done is the PDG grant funds that became available to us in the amount of about $280,000. I'm right in the throes of writing and getting approved a statement of work to get a contractor to develop training and a toolkit for parent leadership. And by 2023, I think it's in December, all the hubs have to have parent councils. So parent voices on both sides, that'll be parent training to be leaders, as well as the professionals at the division and in the hubs, also working with that parent voice and knowing how to work with these people as leaders, as experts of their children, and also experts of their community, and then help them grow, and if they so choose, to develop to become leaders and take on other projects that parent to parent, peer to peer can help us only improve the system that they're using. So thank you for correcting my acronym language about the PDG, the Preschool Development Grant. It is a federal grant that I believe we get for, it's one of multiple states get it. And there's been lots of different amazing work done around the nation that if you have 5 minutes to go look it up, you can see other practices that have been put into implementation using these dollars. So really exciting. And at this time, is there any questions? I tried to make it quick so that you guys could stay on task of your agenda time.
Thanks, Cass. One thing you shared with me that I thought would be important for the committee to hear is just kind of the timeline for some of that capacity building and training support through those preschool development dollars going to build capacity with hubs. Is that, you know, you're kind of projecting that that work would likely be starting next calendar year. Is that correct?
Yeah. Yes. And thank you, Elena. I'm always like a little hesitant to it's like we explained, you know, it's not in the time frame that I would like it to be because I want things to happen yesterday. But I do feel that this is moving at the speed of trust in a very authentic way. And quickly, I can show the group, if I have permission, I'll show the group the timeline real quick, if you guys would like to see that. And then I'll just describe it real quick, because I'm sure you guys can all read. But read this, because I made it very, very simple so that it was very easy to explain. So in the last couple months, we did, with my community systems team, help develop the statement of work for the parent leadership, training and technical assistance, which will also, as I go through the timeline, I'll kind of explain it. But right now, I just got it approved to move forward this week, as you'll see, March 30th there. So this week, we're getting it through all the channels of the approvals and getting the codes put on it to go over into the procurement process over at the Department of Ed. And as you can see, that's the one that gives me, that I wish I could just speed it up a little bit, but it takes about 8 to 9 months for procurement, DOJ, all the processes to go through for me to be able to get this request for application out. So then we'll get our RFP, we'll get that out, and we're going to do about a 2-month bid on that. And then that'll take us, almost to 1 year from right now before we're a contractor selected. So once the contractor selected, it'll also kind of be up to them if they can maybe speed up some things too. I'm not sure, but hopefully they will develop a plan. In my request for this work, ELD will be approving the plan, and then working with parents, hub leaders, ELD staff, and really developing a theory of change around this work and what's needed. And then a self-assessment, some kind of an assessment tool will be used to identify where where hubs are in parent leadership in the continuum. Are they just talking about it? Are they fully developed? What is the technical assistance that will be most helpful to them? And then they'll go into a parallel training phase afterwards of professionals, ELD staff, other folks, hub leaders, sorry. And then at the same time, giving parents the tools that they need to also become at the table and not viewed as not an equal, but an equal. And that way, once that happens, and then the implementation coaching will occur, and then they'll do an evaluation to determine what that follow-up planning of technical assistance will be needed to really make this an authentic, transformative process of how parents are participating in the work that we're doing in building this system. So as you can see, December 22 is when this will all come to fruition. And the good thing is I've also aligned it with the hubs, the early learning hubs around the state, because they are required to have parent councils by December, I think it's by January 2023. So we were mindful of their requirement, tried to roll it back to make sure that we gave really solid, thoughtful time to this work. It's really important. As I mentioned earlier, moving at the speed of trust, it's going to take a lot of rolling up our sleeves. And a lot of people so far are really excited about it. Every hub meeting I hear about what's happening. And the brilliant thing that I want to make sure that I'm really, really careful about announcing, or not forgetting, I should say, is that Healthy Families, all the programs, tribes, other partners that we have in the work, we're really hoping that this parent leadership and family engagement, family voice is really an open door for everyone to participate, and that everyone would be able to reap the benefits of this work that's happening and participate as they want and as they need. And I see this group as a really strong space that's already thinking about how you're developing what you're going to be doing with families, what families are going to be doing to work with you. The fact that you guys have already put that on the map is amazing. Joan, who left us, went back to Michigan. She used to say, well, momentum starts wherever you drop the pin. So we don't have to wait till December 22 to make this happen. We can start working incrementally now to build that momentum and that warm, open welcome when we take place and we get these councils up and running. So I think I have a minute or two. I could take some questions if anybody wants, and I'll stop sharing.
Yeah, Cass, there's a couple questions in the chat about, is the training and technical assistance focused on working with hubs to develop their skills to partner with families and create systems changes needed to engage families as decision makers? That kind of the focus?
Yes, it is. Right now, the dollars that we've allocated, it's about $280,000 is what we will have for this technical assistance and training and a toolkit. The one thing is it is going to be focused on hubs and ELD staff, but in that is partners. So if a parent council is coming together and there's healthy families is part of the system. So I can work with other program partners to make sure that the training is announced. I'm really hoping for train the trainer models is what I'm going to be looking for in the RFPs, because I believe in sustainability, and people come and go and families come and go. So we really want to make sure that we have tools to support people as they come on, not just a one-time stop effort. So that's really important. Will there be opportunities for community input on the plan for training TA? Will you involve families? And yes on both. We're hoping that when they're developing that theory of change, it will include parents at the table. It'll include community leaders. That's my vision for that. Let's see. Raise up Oregon strategy, ensure family voice and system design and implementation. Yes, that is what we're trying to make happen.
What other reflections or questions do folks have on the committee about how I'm hearing opportunities for both building like regional kind of partner capacity within implementing agencies around engaging parents as leaders and decision makers, and then also just through staff's, through CAS's role with the division, building our kind of state agency capacity and muscle around parent voice, which is really exciting for our state. And so I'm just curious if there are other questions or reflections that folks have.
Yeah, this is Beth from Washington County again. As I contemplate this concept of the parent council and wondering about, are they looking, what does diversity of participation look like, and things like, age of child and background for the parent and program participants, and there's a lot of different ways of looking at demographics when it comes to potential parenting participants.
Beth, that's a great thing to bring up. And I think that one thing that we've talked about is the engagement of families around this work, primarily would be, of course, birth through 5, prenatal through 5, focusing on families that have children within those ages, but also thinking on a more holistic kind of community approach too, to where, if you think about it, if your child's 15, at one time you were a parent of a 5-year-old, they just grew, and now maybe you're a grandma to a child that's 5, or a grandpa, and in today's world, the reality, unfortunately, breaks my heart, but some grandmas and grandpas, some aunts and uncles, they're taking care of babies birth through 5. That's the reality. And so we would like, from an equitable community, whole community system, we would like to think about that in an inclusive way, where if you want to come and participate and you want to be a leader in this work and you want to help others, I am not going to shut the door. I'm going to find a spot for you to help, because we need it. It takes a village, right? So that's where I come from the space that everyone's going to be welcome to the table. That's where the Train the Trainer programs come in for sustainability. That's where a toolkit is going to be developed to help the hubs navigate this work a little bit. The one cool thing I'm really excited about in this is a compensation mechanism for families, so that they're adequately compensated when they come to the table, so that they get to come to the table, that we've allowed that space for them, whether it be monetary, maybe it's education, maybe it's mentoring. Hey, next week we have this meeting coming up and you're going to be speaking. Do you need some help with that? Do you need help with your PowerPoint? Everyone wears bunny suits to the meeting, so don't come in a suit. Things like that those helping things like we were talking about earlier, getting things started, those are things you guys can be thinking about right now, like what it really does take for parents and families to get to the table. More than transportation, and definitely not just a gift card, right? That's not always helpful. So really thinking about that work, that's probably one thing I'm really excited about is how are we going to compensate families that maybe don't have social security numbers, things like that. All kinds of exciting work, and there's enough for everyone that wants to be involved can do so. Let's see.
Sorry, I have lots of input and thoughts, so apologies for all of that.
We have one thing about this is I've asked for a literature review on the toolkits that are designed, or the toolkits that are already available, so that we aren't recreating the wheel, that we're using one that, I don't know if y'all are from Oregon, but in Oregon, we all kind of like to do it our own way. So it would be best if we look to what everyone is doing and then come up with something that serves our state the best, especially in communities where some of the toolkits that are out there are big communities. Some of them don't have the diversity that we have. So really taking a strong look at those, but then also leaning into our community and listening to our families and help guide that work to what that toolkit really needs to be.
And I just wanted to give kind of a shout out to Cass in her work in developing this. She's really been focused on that equity lens and ensuring that as she uses that equity lens, she's looking both at racial equity, but also at disability, and ensuring that there's partnerships across agencies to ensure that there's expansion or inclusion of great leaders with families of children who experience disability. And so she's just been such a great partner to move the work forward. So shout out to you, Cass. Thank you.
Thank you. That's very kind. You know, the equity lens came from my former job where I used to work at the Chief Education Office for the Chief Education Officer, Nancy Golden, and really was instrumental in when the lens was developed and how it got launched. So I'm very passionate about it. I am very committed to making sure that that happens, especially for our families around Oregon, definitely. Yeah. And
Benjamin, I think I saw you had unmuted a little bit earlier. Was there a question or thought that you wanted to share?
I was just thinking, on the one hand, it's really exciting that so many different efforts in early childhood are trying to engage family voice, and just sort of thinking about the the need to be really coordinated and collaborative at both the state and local levels, so that we're not inadvertently trying to, like, I don't want, it's not compete, but that we're not inadvertently overburdening families with, you know, yet another opportunity to tell us what they think. And also the importance, and it sounds like this is where Beth was going, what you were saying is the partnership with families in co-creating the work and not just asking them to respond to something, which is better than no voice at all. But let's keep, you know, let's not just stop there and say, oh, here's something we came up with, what do you think? Yeah, just really from the beginning, engaging them in the co-creation of the work.
Benjamin, it's my desire that we get to the top of that continuum ladder to where parents are leaders and they're developing and leading the work to change the system to best suit them and the communities that they live in. Because the one thing that's super important to me that Meredith and I have had discussions about, as well as Elizabeth and Elena and Kelly Poe, my good friend on the line, is that people move, families move. And I want a family to be able to move from Lane County, and if they want to move way over to my friend Kelly's neck of the woods, that she would have a warm door opening and an opportunity for that family to feel welcome in the community. You know, and I know that Brenda's committed to it too. We've had a discussion before about that as well. So there's many people on here that are players in this, and they all are passionate about it like I am. So I think that with a little bit of coordination, I love that you bring up the point about overdoing it. We have Jenny Mendoza, who's leading our research team at the division. So I want to give a shout out to her, because she's kind of taking in what surveys are being developed and why, and what questions are being asked. And maybe this program and this program should join together to do one survey, not 5. And then also the hub directors are working on kind of like a timeline calendar, so that we're not over asking hubs to ask their community partners and families too much at one time, that we're actually being strategic about the work at a 3-year kind of a look. So those are some things that the division has actually upped their game on, that we're trying to really be authentic in this engagement with this work, so families can participate. Because if we're doing it on the fly, I don't know about you all, but I can't do it. I only have 1 kid, and I still cannot get to everything if it's on the fly. So proper planning, great partners, and this strong want and will to make this happen. I think we're teed up for any of you golfers out there.
Well, thank you so much, Cass. It's been, I think from the comments and from what you're sharing, you can just hear this desire for kind of synergy around parent engagement work across our state, both at a local level and at a state level. And so it's super exciting that the division has you on board. And I think you also hear that this committee is open to be your thought partners and to share ideas and feedback with you. And so what you've shared has sparked a few thoughts for me about what, where our committee could go in this work of parent voice and parent engagement, and reflecting back on our January conversation as well. But I'm thinking that it might be better just for folks to have a little bit of time to just sit with what you've shared and process a little bit. And I'm thinking we might want to send out some of these thoughts on potential next steps for reactions via email, rather than trying to have that conversation right now. So you can go ahead and move us forward, Christina, so that we can definitely talk about the strategic planning work that Elizabeth is going to highlight for us. But I just want to let folks know we'll be sending out a follow-up email with some thoughts on potential next steps for our committee in this parent voice work, having heard what the work is that Cass is leading at the division. So thank you so much for joining us, Cass. Really appreciate it. I appreciate your work.
Thank you for all you're doing. And please contact me at the division if you guys need anything, and happy to help, or break it down into smaller pieces and work with you individually in your communities too. So whatever I can do to help, I'm always here. Have a great day, you guys. Take care.
Bye. Thanks, Cass. Elizabeth, I'm going to turn it over to you to spotlight what's coming up with strategic planning. And you might be on mute if you're talking. There you go.
Yeah, thank you. I am recognizing that we're sort of under some time constraints for the remainder of the meeting, and not sure if we want to talk briefly about the kind of the program policy and procedure manual. It sounds like that might need to be saved for another meeting, unless you have other thoughts about that, Elena.
Are you saying that you think it's not possible to talk about best practice standards and strategic planning? That's fair.
I can do my best. Let's, Christina, if you take us back to the program policy and procedure, that particular slide, then maybe I can just kind of look at it and think about how I can sort of highlight a few things rather than maybe go through it in the original plan for detail. I am interested in providing you with an overview about the program policy and procedure manual is really as part of making sure that the committee understands the role of policy and procedure within the program and help prepare you as the committee for the eventual task of providing input into policy and procedure updates that the ELD will want to bring here for feedback. Also, the orientation to program policy and procedures can help you also see the reference points for aspects of program structure that are flexible and which are more fixed and required. And I know that's come up in meeting conversations, the question of where can this committee really have an impact and make positive changes, and where are things pretty fixed unless we're prepared to do some advocacy work at the national office level. So what I was hoping to talk about is no conversation around the policy and procedures can happen without reference to the Healthy Families America best practice standards, and which are based on, there are 12 standards written that are based on really critical elements of best practices, which come out of the research on early childhood programs, and that really identifies what practices lead to the best program outcomes. So the standards for healthy families then are kind of rooted in this, rooted in these best practice standards. It looks like that might be a previous slide we could skip, we could go back to, please. So there are some best practice standards that we won't go into today that really relate to safety for home visitors, safety for families that are pretty fixed. And then we also have some standards that are related specifically to really promoting quality in the service. And we call those the Sentinel standards. And those, some of those were ones we referenced already today around maternal depression screenings, and Beth talked about the ASQs. And there are some other components that we can dive into in a little bit more detail another time. But let's move over to that, forward to the next slide. These best practice standards are then sort of organized into our statewide policy and procedure manual. And within the statewide policy and procedure manual, we also have some local inserts where local programs can put in sort of their practices and procedures. And below, you'll see a bullet that talks about the committee's role. We are every so often, these best practice standards are updated because, of course, there's always more research coming in that helps inform and tweak what really are best practices for good program outcomes. So we are currently, Healthy Families America has currently developed a draft of revisions. And the revisions are currently being opened for feedback from programs all around the nation that do healthy families to say, why are we doing this? How is this better? Here's what we think, you know, the language should really say instead. All of those that kind of feedback and suggestions is currently going into the national office from programs like Oregon's right now. And at some point that will lead us to a place where we'll want to bring some of those to the committee and say, here's what the new best practice standards say. Here's the revisions that we think we need to make, and collect your feedback and input on that. So very exciting. And also I want to just give a nod right now to Emily Berry, who, if she's back on the meeting, is on the HFA panel, which is the group of folks who actually helped develop these revisions. So we're super lucky to have her expertise within Oregon, and I know she'll be helping to help us really think about the best ways to implement the new standards. And I see there, Brenda made a great comment, which is this policy and procedure review an opportunity to talk about alignment between HFO and Family Connect? Yes, what we see in the new best practice standards is some different language around the 2-week screening window. And this will also be an opportunity, that feedback loop we have with the national office, to talk about what standards are cumbersome or could create barriers for programs to implement Family Connect. And thank you for pointing to that. It's very much on my mind as well. So I see a Yahoo under there. Great. Emily, if she's on, is there anything that you would like to add to this tiny little thumbnail sketch of our best practice standards and policy and procedures upcoming review?
Yeah, I think that was great. I think you're right. Like the best practice standards, they definitely respond to the research. What I also appreciated when we were reviewing them as a panel is looking at national trends and which standards are more often in compliance or out of compliance, and maybe why. So it's not just responding, I believe, to the research, but also practice. Like what families change, and so programs also need to change. So I'm really excited to hear the feedback, both from HFO and HFA, just nationwide and at our local level. And you know, some HFA programs are statewide coordinated, some are not. So I kind of what I like best about this model is that you're right, there's some like pretty clear, more like rigid standards, but most of them have the ability for programs to respond to the communities they're working with. So that is what I'm really looking forward now. And there's some pretty big changes. There's some things that are staying the same, but there are some big changes as well too. And I like how they're calling it the 8th edition. So there's an 8th edition until there needs to be a 9th. There's not like an expiration date, I suppose, on the standards too. So we're going to really kind of, again, respond to both research and practice input.
Wonderful. Mm-hmm. Thank you. You'll see I was going to call out a particular standard, which and actually policy, which relates to feedback opportunities for families. But for today, just know it's there and we can examine it in a little more detail another time. I want to move on to the slide around the updates to the Healthy Families strategic plan. I know we're fitting a lot in today, so thank you for rolling with it. To begin with, I want to recognize that the best practice standards we just talked about require that as a centralized system, the way Oregon is, with ELD as sort of the central admin, that we have a strategic plan to guide and focus planning and decision making. And it's a requirement that the advisory committee really help carry that strategic plan forward. So from about 2017 to 19, Best Beginnings Committee, which was sort of the predecessor to this one in a broader format, and programs and families were involved in supporting the development of a strategic plan for healthy families at the Early Learning Division. And the draft was created. A lot of input was gathered from the committee, staff, families, and some of you here participated and supported that process. Some of it was, written surveys, some of it was focus groups, some of it was just structured conversations, and there was a lot of pieces that came together for that. And at the same time, in about 2018, the Early Learning Council began undertaking a process to create a statewide early learning system plan that resulted in Raise Up Oregon, and it's this little document here. And it's a big document, actually, but when the draft strategic plan was reviewed by ELD management for approval, it was apparent that some of the language in the HFO strategic plan draft didn't fully align with Raise Up Oregon, and there were just some areas where more clarification was needed. And the request was made to kind of reformat and tweak the plan to more clearly nest within Raise Up Oregon. So we're in a sort of awkward moment because so many of leadership that was involved in that original strategic plan are not here with us, but many of you, fortunately, still are. And we want to respect the historical context of developing the document. But as I've looked at it, I don't always understand what the intent was for some of the pieces of it. And I want to support the committee to kind of maybe massage and tweak some things to fit within Raise Up Oregon and find the best way to kind of move the plan forward into finalization. So I want to stop there and just kind of get some comments or feedback if there are any before I say more.
Elizabeth, it sounded like updating the strategic plan is going to be work that's really led by ELD and ELD staff in order to ensure that there is strong alignment with Raise Up Oregon, and that the role of our committee would be to kind of review an updated version of the strategic plan and have an opportunity to weigh in, but then also to support and help think through implementation. So to kind of hear updates on how the plan is being implemented and whether there are opportunities for us to weigh in on some of the specific implementation strategies. Is that right?
That does sound right. Thank you.
I have a quick question. The other thing that I was having a little bit hard time understanding is for the strategic plan that was being worked on, was there feedback needed regarding the strategies that were being developed based on, was there more understanding needed about what was written? I guess I'm a little bit unclear about that.
Thank you, Beth. From my standpoint, the answer is yes. I was unclear. For example, some of the language is very broad, and I was unclear if there was a particular intent. It's sort of like those tips and intents, sections. I wasn't quite always sure what was intended. So for those of you that have been for those of you that were part of that plan, incorporating that into an updated conversation about it would be helpful, just to kind of see what your if you feel that something is missing or that something's been misunderstood that was intended differently.
I think I'm catching myself up a little bit on the historical context. So Elena, what I'm hearing is that the ELD is going to create the strategic plan. We'll be offering input. And I'm also wondering how it will align with, I think what I'm more familiar with looking at is like the program goal plan for HFA. Is it a little bit like?
If I can respond, I think in a multi-site system, the programs are only required to do program goal plans, right? They are not required to have those program goal plans necessarily reflect the central admin strategic plan.
Mm-hmm. Okay.
So they're not, while certainly there is overlap in some cases, the program goal plans tend to be focused on feedback from site visits around adherence to the model. Mm-hmm. And that's what's required of programs. But for central admin, it's a strategic plan.
Which isn't necessarily particularly an HFA requirement in the same way. Is that right? It is. Okay. And so in this case, what would be most helpful is how it aligns with like the 3 early learning division goals, like a safe, stable, attached. Okay. I see nodding.
I think that's one conversation. It's also how it aligns with what was intended in the original. I think that's also an important conversation that we need to make sure happens too, because I don't want to disregard in any way all of the work that went into the previous version.
Mm-hmm.
Elizabeth, it sounds like you're already thinking of ways to kind of connect back to folks who gave input to inform the last draft, just to clarify some of the intent and think about how that input can inform kind of a new draft. And so is there any way that our committee can be helpful, or members on the committee can be helpful in that work prior to the division having a kind of updated draft for us to consider?
I think Thanks, Elena. I think there are some specific targeted questions I could share out with the committee, and those of you who have participated in it previously might have some comments or feedback that would be very helpful to me. And then from there, I'd like to be able to just send out an updated version ahead of, you know, frankly, in the next few weeks, if possible, so that I can really, so you can begin to look at what's been updated and feel ready to have more conversation about it in an upcoming meeting.
Mm-hmm. I have one more question, because I am still lost a little bit on the historical context, and I'm thinking, Beth, was this part of the conference in which the program managers and the supervisors separated? So I'm thinking the biggest feedback who you're perhaps looking for is from maybe program managers or HFO coalition or something, because I remember that time where we separated and we did something else.
Assuming that I'm thinking of the same work, then yes, that was when we worked on it.
Okay.
So questions? This is Martha. I have a question. Yeah, I have a question. So is this the strategic plan of HFO that we're trying to do? Because if it is, should HFO not have, and the program managers not have the input to give to the Early Learning Division and Early Learning Council instead of the other way around? I mean, when we did Raise Up Oregon, I was on the council. That was more for guidelines. It wasn't to dictate.
Yes, so I don't think that there are substantive large changes to the intent of the original strategic plan, but there is some rearranging, and also, you know, bringing this to the committee, really digging into some of the strategies for how to move some of the work forward. But in terms of not having the ELD drive the goals, the strategic plan goals, but rather have that done by the programs, I think it has to be, since it is the plan for central admin to implement, it is actually not a plan for programs to implement as much as it is for central admin, then there has to be kind of this back and forth around it. And I don't mean to in any way disregard what the input programs have provided, but it does have to sort of focus on the ELD work.
Sure, but it should be a back and forth, not a one way.
Right.
Okay.
What I'm hearing is there are a lot of opportunities to build on the input that's already been collected, both in informing the last strategic plan and just in informing Raise Up Oregon as a really important foundational starting place, and then also building in opportunities for additional input. And so really appreciate your work on this, Elizabeth. And I'm looking at the clock and seeing that it's 4:30, and I just so appreciate everyone that those 2 hours flew by and we needed to cover a lot. So I appreciate everyone sticking with us, and just wanted to wrap up by sharing that our next meeting is scheduled for July 13th. So instead of the first Tuesday, we're moving to the second Tuesday in acknowledgement that folks might be out for the long holiday weekend, that first week of July. So we will look forward to seeing you all then. And in the interim, you'll likely be receiving a couple emails from us with some updates and things for your review and consideration in the interim. Thank you all for your time, and please have a great rest of your day.
Thank you.
Thanks, everyone.
Thank you.